Does radiation exposure increase leukemia risk? Imagine a tiny spark of energy hitting your body that can cause long-term changes. That spark is ionizing radiation, which has been proven to increase the risk of developing leukemia. When the body is exposed to moderate or high doses of this radiation, especially during childhood, the risk becomes more significant. Scientific studies show that radiation can damage the DNA inside bone marrow cells, where blood cells like white blood cells are made. This damage can lead to mutations, which might turn healthy cells into cancerous ones, including leukemia. The relationship between radiation and leukemia follows a clear pattern. The more radiation you are exposed to, the higher your risk of developing leukemia. Even small doses, like those from medical scans such as X-rays or CORT scans, have been linked to a slight increase in risk. For example, a cumulative dose of around 100 mg to the bone marrow has been associated with about a 20% higher chance of developing certain types of leukemia, like non-chronic lymphocytic leukemia. This shows that even low levels of radiation can have an impact, though the risk is smaller compared to higher doses. Certain types of leukemia are more connected to radiation exposure. Acute myeloid leukemia, chronic myeloid leukemia, and acute lymphoblastic leukemia are all linked to radiation. However, chronic lymphocytic leukemia seems less affected by radiation exposure. The timing of exposure matters too. Children exposed to radiation are at a higher proportional risk because their developing bone marrow cells are more sensitive. Plus, they have more years ahead for mutations to develop into leukemia. Long-term low-dose exposure, such as working in the nuclear industry or undergoing repeated medical imaging, also increases the risk of leukemia. Large studies of nuclear workers from different countries have shown a consistent link between prolonged low-dose radiation and higher leukemia mortality, excluding chronic lymphocytic leukemia. The biological reason behind this is that ionizing radiation damages the DNA in stem cells in the bone marrow. If this damage affects genes that control cell growth, it can lead to uncontrolled white blood cell production, which is what happens in leukemia. To reduce the risk, it is important to limit unnecessary exposure to ionizing radiation, especially in children. Medical procedures involving radiation are carefully regulated to ensure the benefits outweigh the risks. Occupational safety standards are in place to protect workers from excessive exposure. If someone has a history of radiation exposure, regular monitoring for early signs of blood cancers is recommended. Overall, radiation is a well-established risk factor for leukemia, and understanding this helps in making safer choices and improving health guidelines. Always consult healthcare professionals for personalized advice and to understand your specific risk factors.